Hey everybody, this is Dr. Ward with the Ward MD Institute. I wanted to talk to you about fat grafting today. Fat grafting is one of our favorite procedures. One of the reasons we like it is because it really helps restore youth. As we age, we're all familiar with what gravity does, right? It pulls things down. So my cheeks start to go in, it all accumulates kind of here. The other thing that happens as we age, the second thing, is that our skin changes. Like if you look at a microscope at somebody who's 20 versus somebody who's 80, their skin's going to be different. It thins, there's different shape, there's different cells that are there, different proportions of the cells. So that changes. That's why medical grade skincare is important. The third thing that changes though is the volume of our face changes. Not only does some of the soft tissue change where we lose some of the fat of our face, but actually the bones change. Like our cheekbones, our mandible, our jawbone changes. They shrink with time. So oftentimes we need to add volume, and sometimes that's the only thing that people need is adding some volume to the face to help restore it. That's one of the areas that fat grafting comes in. Fat grafting is a great option for that, for the patient who needs extra volume. It's really cool because it uses your body's own tissue, number one. But number two, the really cool thing, as opposed to fillers, it can last forever. Now, that's an important thing to say. As I said, it can last forever. It doesn't mean it necessarily does last forever. Qualifying factor for that is all the fat that we transplant from, say, like your abdomen or your thighs to the face, all that fat that we transfer, of all those fat cells that live, they will be there forever. So what I mean by that when I say the fat cells that live, those fat cells that come in and they get a good enough blood supply that they are healthy and that they can, live in that new environment, those fat cells will live and they'll be there forever. So yes, you might be asking yourself, does that mean if I gain weight or lose weight, they'll change? Yes, just like any other fat cell. When we gain weight, our fat cells expand. When we lose weight, they shrink. Same thing will happen. If we gain weight, it'll go up, it'll get smaller. Which in the case of the face, we kind of want, right? Like we want, if we get a little bit bigger, we get a little bit thinner, we want it to be proportional. So that's not a bad thing, that's actually a good thing. And the fact that it can be there forever is also a really cool thing. What percentage of the fat lives? The studies are all over the place. There's some studies that show like 0% fat survival long-term. There's some that show 100%. What is the true answer? Well, I think it's probably in that 70 to 80% range. I typically overfill by about 20%, knowing that some of that's going to be lost with some time. So keep in mind about 70 to 80% of it is going to stay and live there forever. So that's fat grafting. Now, where do we put the fat? Well, one of the most common areas is in this area right here, in this area right here, in the under eye. This kind of mid-face region right here is a super common area where we're going to add some fat to help increase the volume and rejuvenate and volumize the face to give it a kind of really beautiful, youthful appearance. We don't want to make you look puffy. We don't like, big pillows on your face, but we do want to add some volume there that just looks nice and healthy and natural. I will often do this procedure. In fact, most commonly I do this procedure with other things. So for example, if I'm doing a facelift, I will really commonly add some fat here. I'll add it to this area right here. I'll maybe even add some to the chin, a little bit to the lips. I don't like to add a ton to the lips, but a little bit to the lips, and then to the cheeks and the under eye area just to help refresh and revolumize things. It looks very natural and it helps enhance the results. So it's a terribly powerful procedure. It's a wonderful procedure that people just absolutely love, and it gives a very natural result. So that's roughly what we do with fat grafting. Now, in terms of where do we get the fat from? Because a lot of people wonder, well, wait, can I donate to somebody else or whatever? No, it has to be your own fat. We typically take it from the abdomen. That's where I like to take it. So if this is the belly button, I make a little incision on each side of the belly button and go through and take that out on each side. It's not typically enough for the face that you would notice any difference. It's not like you're getting like real old-fashioned liposuction where we're trying to thin the belly down. We're just taking enough that we can use it to transplant it into the face. So in terms of the fat that you'd notice from your abdomen, it's probably not going to be something you really notice. Same thing if you have to take it from your thighs, same sort of thing. We're probably not going to notice a big change in your thighs. We just don't have to take enough to make a big difference. Once we do that, then there's a kind of a process we go through to process the fat so that we're not injecting like all the oils and the blood and stuff that might come out with that. And we inject that into the face. Again, the fat that lives is going to stay there forever. It's like permanent filler that is your body's own tissue. So it's a really cool sort of process. So I do it frequently with facelift. I do it frequently with lower blepharoplasties. I do it to the lips, do it to this area right here. And it's just a great procedure. In terms of risk, we're going to talk about the main one, which is that the fat, we don't know exactly what percentage of the fat is going to live, what is going to die. So a little bit uncertainty, but that's true for anything with aesthetics, is there's some uncertainty with everything that we do. So keep that in mind, is that it might be a little unpredictable about how much is going to live, how much is not going to. That is super rare. I've never had a case where I'm like, oh my gosh, like it all went away, or oh my gosh, we added too much. What are we going to do now? That just doesn't really happen. The final thing to know, if there's a risk of infection, that risk is very, very small. In fact, I don't think I've ever seen a case of infection, but it's something that we always tell patients. You're going to be a little sore from the injection sites. You're going to get bruised on your abdomen or thighs, where we take it from, as well as the places that we put it, where we put the fat. It's just a great procedure that's very natural, and people love it.